Welcome back to Bottles, Boobs, and Feeding Tubes. It's me, MPT, your partner from Bump to Baby and Beyond. Today I'm going to talk to you about mastitis. What is mastitis? Mastitis is a breast infection or inflammation in the breast tissue, usually caused from breastfeeding. However, some non-breastfeeding women can get it as well. Signs of mastitis would be pain, redness, swelling, tender to touch. Sometimes your breast may be warm and red in areas. You may even feel like you have a clogged duct. There's two types of mastitis: non-infectious, which is just from a blocked duct usually, and infection, which usually occurs after the blockage has not been cleared for a long time. Bacteria was able to settle and grow, or sometimes it's from like cracked nipples from breastfeeding. How do you get a blocked milk duct? That usually comes from not completely emptying or draining your breast. Sometimes, if you're breastfeeding and you kind of slept too long and you wake up and your breasts are really full and engorged, and then you're trying to empty it out, you may notice that some of the milk is not emptying out all the way. And if that continues to happen, you can get a blocked duct. A bacterial infection is from cracked nipples, usually from a poor latch. So when you're breastfeeding, you want to make sure you have a good latch. It should never be painful. So if you're noticing that every time your baby latches, you're having some form of pain, you need to speak with a lactation consultant to help figure out what could be causing that poor latch. It could be that the baby doesn't have a good latch. It could be that your nipples are slightly different that are preventing the baby from latching well. Or it could be that the baby might have a tongue or a lip tie that's preventing it from getting that full latch and suction to be able to get all of the milk out every feed. Other risk factors for it would be wearing like a tight bra that doesn't help with circulation in that area, because your breasts need a lot of circulation and be able to flow and all the milk be able to develop. Sometimes you can get it, like I said, if you overslept or if you're starting to wean the baby off of so many feedings, or you're transitioning to bottles and you're doing it rapidly and you're not slowly decreasing your milk supply. That's another way you can get a blocked duct that could lead to mastitis. How to treat mastitis? You want to continue to breastfeed, even though it's painful. And I know you might be like, no. Or you want to pump in order to get that milk to continue to flow, to help get rid of that block. You will want to massage the breasts. Warm compresses can help with that. If you're noticing that you're getting really engorged and you're trying to wean your baby off of the breast, then you would try to decrease your milk supply. You want to also make sure you're resting, staying hydrated. Hydration will help keep milk production going and keep your milk flowing, so that when your baby is feeding, you're able to empty your milk supply completely. And how you can prevent it is make sure that you are feeding your baby or pumping at your regular schedule. The more you skip feeds, whether the baby is taking the bottle and you just decide you're not going to pump, that will decrease your milk supply, or it can increase your risk for getting a clogged duct. You also want to make sure when you're breastfeeding, you're alternating breasts. Make sure the baby feeds on both breasts at each feed. If you are noticing that your nipples are cracked and sore for whatever reason, there's cream that you can put on there to help clear it up so that it doesn't get infected. Make sure the baby has a proper latch. As babies start to grow in their teeth, make sure they're not biting you. Some common myths are, do I have to stop breastfeeding? No, you do not have to stop breastfeeding just because you have an infection. Even if the treatment for the infection is antibiotic, the provider will put you on an antibiotic that is usually safe for the baby. One other myth, it only happens to people who don't know what they're doing or first-time moms. That is not true. Mastitis can happen to anyone that is breastfeeding or not breastfeeding after having a baby. When your milk comes in, even if you choose not to breastfeed, your milk still is produced in that first couple weeks of life. So even though you're not doing anything to stimulate that outflow of milk, you can get a mastitis breast infection during that postpartum period. So if you are a first-time mom or a repeat mom and you're watching this video to find out what is mastitis, if you've had mastitis, let us know in the comment section below what you did and how it was treated for you. Make sure you subscribe to our channel, and thank you for watching this video on mastitis.